Welcome back to Inspire Great Health. I have Ashlee and Natalie with me today, and we're going to be talking about Suicide Awareness Month. So please use caution when watching this episode. It can be triggering, but this is a very important topic that we want to cover, and we want to, have people know where they can get help if they need it. So, Ashlee, we'll go ahead and start with you. Please introduce yourself.
Yeah, my name is Ashlee Mickelson. I am an LCSW, so a licensed clinical social worker, and I am the Director of Practice Operations at Behavioral Health Outpatient.
All right. Natalie, welcome back.
Thank you. Yeah, it's great to be here again. Yeah, I'm Natalie Villalobos, Director of Social Work for our Inpatient Behavioral Health Services through CRMC as well, and I'm also a licensed clinical social worker.
Okay. Well, thank you both for joining me today. I'm happy to have you both here. So what interested you both about working in mental health?
I'll let you go first.
Yeah, I think it's funny. I think I ended up in mental health. I don't know if it was initially my interest. However, once entering into mental health, I think what definitely keeps me interested is just getting to know people, meeting people, talking to people. Everyone has a different story, and mental health it's not black and white. It's definitely more complex than, your medical things, doing heart surgery or something like that. It's very, every person is very individual and everything is so different, and that's really what I enjoy about mental health. Mm-hmm.
Kind of the same for me. I kind of fell into it. I took a job at a group home and it kind of was something fell in my lap. I was just doing it for money in college. But for me, it's the change process. So seeing people who are in really just rough spots and just not doing well and seeing them get better and change and their lives improve and their relationships, for me, that's what keeps me in it, even though it's really hard. And so just seeing people live the life they deserve to have is really what keeps me in it. So that's great. Mm-hmm.
So September is Suicide Awareness Month. So can you tell me just a little bit about why we honor it and what we can do to help others during this month as well as in the future?
I think it's important to honor it just because it is a cause of death for our families and friends. It's part of that. And so with Wyoming being, I think, so high ranked in the states for the highest suicide rates, I think it's, us, Montana, Alaska, and Idaho. And so it's important for us to be aware that there's an issue and that it's ongoing, and for people to be aware to, look for things amongst, their families, friends, colleagues, just to look out for each other and support each other.
I think it's important, too, because suicide is such a scary word for a lot of people. And we really try, especially what we do, we talk about all the time, but we're really trying to help people understand that this isn't scary to talk about, that it is important to talk about, because that's what helps people be brave enough to go find help, is if we don't talk about it, it will continue to be something that someone suffers silently with. And so it's really important to talk about how common it is and how we can help people. So
now let's dive a little bit deeper into this topic. When it comes to people who have thoughts of suicide, what are some things that we as their loved ones or just as a colleague, friend, what should we look out for?
Definitely changes. We know our people the best. So our friends and families that we're around often, we kind of fall into these habitual kind of habits that we have. And so definitely being mindful of someone's change, maybe isolating more, maybe giving things away, just, even just a change in their affect, maybe someone who was very bright at some point, maybe now a little more disengaged. And then vice versa too, because there's also research that shows that people might become more outgoing before an attempt or an issue with depression. And so it's important just to kind of just look out for each other, I feel and be aware of how are you doing? And I think with the movement where mental health is going, I think we've gotten away from thinking that if we ask someone if they're suicidal, that it's going to evoke or prompt those thoughts. And that's not the case, and it's been shown. And so even just asking someone, do you feel like you're having those thoughts of wanting to harm yourself, or, just having those frank conversations. I feel even with friends, you talk about so many things. You talk about sensitive issues with your close people. Yeah. And so don't hesitate to talk about those things. They're just as real and important to each other.
And I think, too, with a lot of the research, especially in Wyoming, we're really making a big effort to, look into, why are suicides happening? Like Natalie said, I think we're, number 2 in the country. We were number 1 for a really long time. And so I think also important to take a note, big life changes. So we are, kind of Cowboys at heart, and everyone keeps quiet and kind of does their own thing. And so you might not even see a change. They might be still getting up and going to work every day, and they still may be doing their normal, but there's been these big life events that we don't talk about. Like they got a divorce, or they're losing their house, or they lost their their job that they loved, or even like terminal illness. Like we see that a lot where people get a cancer diagnosis or something that's really overwhelming. And those big life changes can also kind of elicit that. I mean, we see that someone has a crisis. I think it's like 2 weeks prior to their attempt or completion. And so looking at like, did this person just have a really big event and maybe they're just not talking about it? So I think if you see that, asking your friends, because that has been a big indicator that we're learning. It's just kind of these big life changes that no one's talking about. So
just check in with your friends if they have had these giant changes in their lives. Okay.
Yeah.
Yeah, talking about stress. I think because we talk about stress with our friends, to try to vent, and so just paying attention to those things that people are going through, I think, is super important.
And broaching the subject of someone potentially thinking of suicide can be difficult. How do you have any recommendations for how to approach this subject with your friends if they have not come to you first and you're concerned?
I think if there's a way to ask, if there's a way just to, or even be there, or, try to be supportive with them. And so, and like I mentioned, it's don't fear asking those tough questions with somebody, especially if it's been prompted enough, and I like to always have like what I call like my evidence behind something, like, hey, I've noticed this because of X, Y, Z. And, just so it's not like so confrontational of like, oh, what do you mean? What's going on? It's like, no, I've just noticed a few things and, want to make sure that everything's going okay. And just like being there. Some people just want to be heard. You don't have to have the answers or like the perfect solution for everything. I think that, when we talk amongst our friends, you try to think of advice and you're always like, oh, maybe we'll try this. Have you tried that? And sometimes people just want to vent and be heard. And I think that's important too. I hear a lot from people say, I wish I could have done more. And that's not really always the case. Sometimes just being there and being present is what someone needs. And so don't think of it as like, well, what else can I do? There's got to be more. Like, just do what you can. And even just asking the person, like, what do you need from me in this moment? I think is very important, because sometimes it's just, I just need you to talk to me, or this has been helpful in general just to process these thoughts that I'm having. And so,
And I would kind of add on to Natalie, not being afraid. Like, I think so many of us are afraid that we're going to cause someone to think more about it, or we're going to put that idea in their head. And that's not true at all. I think those people are so alone that even just someone asking them about it, it's got to be a relief. And it is a relief. And so just not being fearful. And I think removing any judgment or fear from those questions of like, not asking, you aren't thinking of this, are you? But more of like, hey, are you thinking about this? Are you okay? Not being afraid to use the word suicide, not being afraid to just ask them directly without judgment. And I think that's the best way to do it. And even using your own personal experience, because I think most people have experienced depression at some point. It's okay to say like, hey, I've gone through that. I'm noticing this with you. Or it's pretty common to think about this after something. And so kind of removing that judgment and just not being fearful that you're going to cause someone to complete or attempt or something just by talking about it. So
I like how you mentioned like someone's probably maybe gone through something, or I don't think we're always talking about some of our mental health things, but maybe someone, or you just relate in some way, and that can just kind of evoke that conversation with somebody.
And kind of helping people realize too, like, just because you're having these thoughts does not mean you're going to go to the hospital. It does not mean that everything in your world has to change. There's definitely ways to get help without that. So I think people are so afraid that someone's going to like drag them to the hospital if they express that they're, having these thoughts. And I think recognizing that doesn't need to be a fear. There's a way to support people. So
don't be afraid to have these conversations is the big takeaway, because, if you're afraid to have these conversations, I don't want to say it could lead to something worse, but just don't be afraid to be there for your friends is what I'm taking away from this.
And the worst that can happen is they say no, and you at least were showing your support. And so I think it's okay to just, hey, I'm going to take this risk and ask them, because at least they know that I'm watching out for them. So,
and they may, because they may say no at first, but even just like prompting that conversation is like, oh, Ashlee at that one moment talked to me about this. I can go to her when I'm ready.
Yeah.
Because maybe in that moment that person's not ready, but it just kind of plants that seed of like, this friend maybe has some insight that can help me a little more, and they might be that go-to person next time.
Yeah, I agree.
Let's take it from the opposite side. If you yourself are having suicidal ideations and you're afraid to ask for help, how would you express that to somebody? Is it, it's hard, even with your closest friends, it can be hard to admit to something like that, because some people feel like they're a failure, but that's not the case. How would you broach that subject as someone who is considering suicide?
I think even you don't have, when I see people in the emergency room and taking it kind of from this perspective, is like you don't have to tell your entire story or feel too vulnerable in that moment, but just that you can ask someone in that moment to like maybe help point you in the right direction or help get you to the right place. I think just being able to get there, I think we assume if we ask someone for help, we have to tell them all like the ugly parts of it and things like that. And I mean, I've seen families and friends and even coworkers and colleagues bring somebody in and just be like, they just reached out to me today. This is what kind of needed to happen. I don't know a lot of what's going on, but I'm here for support. And I think that helps people to just understand, like, knowing that, like, yeah, if I can just ask someone, maybe they can just kind of point me in the right direction.
Yeah.
They have me and Ashlee were talking about, they have 988 and 211. And, if you don't have, like, anybody really around you to talk to, if you have a physician or, a mental health, like, clinic that you're aware of that someone's mentioned to you, like, just stop in and just kind of talk and look around and see if they can help in that moment, too. And, I mean, there's places to reach out to. I know that can be overwhelming. But just that first step is like, hey, I need some help. I don't know what it looks like, because you don't have to know what it looks like.
Yeah.
You don't have to have the answers, but hey, I need some help.
And 988 is a great option too, because you can text. Not a lot of people want to like have that like open conversation talking, so you can text them and they can help lead you. And I agree with Natalie. Like, I think just finding anyone, it could be a coworker, it could be a boss that is like understanding, and sometimes just having someone like help you, because that first step feels really daunting of like, hey, I'm having these thoughts. Can you help me get to the right place? And so asking someone that you trust to just help you with those steps. And I think also being aware that like more than likely someone has probably had these thoughts. And so reminding yourself that like, hey, this might be scary, but I guarantee there's someone out there in my world that will help me and go in the right direction.
Would you say that suicidal ideations are somewhat more common than we think?
Oh, yeah.
Yes.
Yes. Okay.
I like to kind of combine it with like thoughts of death and suicidalation. I think it's more common than people think it is, especially as you start to age, you kind of think of your own mortality. I think those are thoughts that just come up with life, and as you get older, you start to lose friends and family, and it becomes a little more common, I think, and even in conversation of thoughts that you're having of like, well, I don't know if it's just worth it anymore, and being mindful, I think, of statements like that people make, like, well, it's just not worth being around here, or, I don't know if there's anything worth living anymore. I think it's important to pay attention to people's words and just kind of how they're communicating when they are going through stress.
I think it's common, way more common than we really ever talk about. I think probably most people have at least a passing thought, whether it's a plan or not. And so I think that's why it is important to talk about it. And I always tell my clients is that a lot of times for them, suicide is more of like, I feel so out of control. And so it's recognizing that too, that like sometimes it's, hey, I have no intention of doing this. I just feel so out of control of my world or hopeless in my world. And so I think helping normalize that helps people understand like this isn't something to be as ashamed of or fearful to talk about. So
what are some resources that we can offer, we as CRMC and we as a community can, and as a country can have to offer those who are struggling with suicidal thoughts?
I think 988 is a great one to start with. When we have our own Wyoming chapter, and they're really working hard to try to be available for people. I think like if you're a veteran, they have their own hotline as well, which is really helpful. So that's a great thing. I think really, and I speak for most of mental health people in this community, if you were to call someone, a clinic, just any clinic, and be like, hey, I'm struggling, I guarantee that clinic will do whatever they can to connect you with either someone in that clinic or somewhere else. Like if we have someone who calls us and they're like, hey, I'm really struggling, need to get in, we try to get them in if we have openings. Maybe we send them down to the ER to kind of be assessed if it's high risk. And so, I mean, I think even just cold calling anyone in the community who has services, they're going to at least try to point you in the right direction. If you feel like overwhelmed by trying to get help, that's just a great place to start, because we're always going to do what we can to help someone who calls. I think, there's hotlines, there's support, there's all the clinics, VOA here, Cheyenne Regional. So I think just reaching out, just trying somewhere is the best place. So to start at least.
And if the ER is an option or needs to be an option, I don't ever want to hesitate from doing that. I know it can feel a little overwhelming, but we don't admit every patient we see in the emergency room, and sometimes that's just a stop of like, here's what's going on, I need some help, and then we can point you in the right direction, and hopefully maybe just kind of wrap around and plan, to help support that individual. And so I think it's good for people to know, like, not everyone that goes to the ER has to be admitted, and if you do, it's a couple days, to get maybe some medication stabilization. I think I'm hearing more common now that it's just harder to get your meds or people have to wait. And so don't hesitate till you pop into a clinic or call a clinic and try to ask for help.
Yeah.
And 988 you can text or call, correct? Okay.
Yep.
So those are options that you have if you are considering suicide. Please do not be afraid to reach out and ask for help with anyone or any of these resources. Those are all the questions I have for you. Is there anything else you'd like to add?
I think this is awesome that we're
Yeah.
having these conversations. I
Yeah.
think that's definitely a step in the right direction. But yeah, I think just urging people to look out for each other. We're a small community. You know, we know some of the things, or if someone's had an experience, and so just being able to reach out to somebody, I think, is helpful. I know there's so many people that don't have anybody, but I don't want that to hinder someone from asking for help, because that's what we're here for.
Yeah.
Mm-hmm.
And I think it's important to add, and this is one thing that really was eye-opening for me, is we always do, or we try to do this, State of Wyoming does a suicide prevention awareness conference. And we went 2 years ago probably, and there's so many subgroups of people who are aware of the risk. There's a rodeo group, there's an agriculture group.
Yeah.
And so there are these little groups within maybe your interests or your areas that understand how big of a deal this is. And so I think sometimes that can help people to be I'd rather talk to farmers. I'm pretty sure that agriculture has its own just for people who are in that field and how high risk it is, or just for rodeo people. And so I think it's okay to recognize that there's probably somebody who gets you, who understands the risk of this. And so don't be hesitant to reach out, because we can help you find those resources. There's also, in Wyoming, especially Cheyenne, I think they're doing a great job of trying to bring awareness to this. We have the Out of Darkness Suicide Walk this weekend that's going on in Cheyenne, the county this weekend. And so there's lots of resources out there. And so I think just getting out there and talking to people, and you'll find that they're there. So.
Well, thank you both for joining me for this conversation. It can be a tough conversation, but this felt very easy, and I hope that if you need help, you realize that it's easier to talk to somebody than it is to go without getting help. So please do not hesitate to get help. Use our BHS services. I've used our BHS services. It's not scary. You guys are amazing over there. So I appreciate all the work that you do for us. So
Thank you.
Thank you.
Appreciate
Thanks
it.
for
Thank you.
having us.
Yes, of course.
Yeah.
Thank you for tuning in, and we'll see you next time.